Rhinoplasty is the operation that addresses not only the cosmetic concerns of the nose, but the functional concerns of the nose. It's a two-tiered operation. This means that we want the function of the nose to be on par with the form of the nose. The goal of rhinoplasty in my practice is natural. That means that the nose not only has to be in balance with the rest of the face, but it also has to be in balance within itself. And that particular sensibility is what gives our patients natural results. We never want patients to have other people ask them who did their nose job. We want patients to look like they were born with that particular result. And this is what we usually achieve with the rhinoplasty operation. There's many reasons to have rhinoplasty. The most common reason is patients who want to reduce the size of their nose. The nose is intended to be in balance with the rest of the face. Most of the time, when patients come in for a primary rhinoplasty or a first-time rhinoplasty, they would like their nose to be in better balance with the rest of the face. My goal with rhinoplasty is to reduce the nose to a point that it looks natural. We never want to over-reduce. We never want to have patients look unnatural. So the goal is always balance with this operation. With revision rhinoplasty, most of the time patients come in dissatisfied with a surgical result from another surgeon. The goal with revision rhinoplasty is generally the same as with primary rhinoplasty. We want to improve balance within the nose and between the nose and the rest of the face. But typically it can be either a reductive procedure, which means we're still trying to make the nose smaller, or it can be a constructive procedure where we're trying to build up the nose from over resection. It's a more advanced procedure because many times we're dealing with scar tissue and it takes longer in the operating room. It's a much more detailed operation and much more technically challenging, but still just as interesting as a primary rhinoplasty. Many patients want rhinoplasty because they have a functional problem. Either in revision cases, patients have had a rhinoplasty elsewhere and they've developed a functional problem where the airflow through the nose is inadequate, or patients who have a septal deviation. The septum is the structure inside the nose which divides the nose into two sides. It's made of bone in the back and cartilage in the front. Many times this structure can become deviated either congenitally or through nasal trauma. And when it does become deviated, it causes airway obstruction. In addition, this airway obstruction can interfere with the function of the sinuses. So many patients develop sinus problems as a result of a septal deviation. Other patients can have the deviated septum be the cause of headaches. So many times I've found that a septoplasty improves the severity and the frequency of their headaches. The downtime for rhinoplasty is 1 week. We remove all of the tapes and the splints at 7 days after surgery. Typically, patients are socially presentable within that 7 to 10 day postoperative timeline. All of my patients return to their full unrestricted activity at 14 days after the operation. That means they can go back to the gym, go back to sleeping in their bed in a flat position, all of their work activities without any sort of restrictions.